Hello, I'm Dr. Serge Marinkovic from the Department of Urology at Detroit Medical Center, Harper Hospital. Our video details our approach to sacral neuromodulation. We believe the lower the voltage utilized to attain a good bellows and plantar flexion of the big toe, the better the long-term control of frequency and urgency with a greater than 5-year follow-up. We in particular equate achieving the above neurostimulation at 3 or less volts as leading to better control of overactive bladder symptoms. Here the patient has been sterilely prepped for a stage 1 interstem placement. A blue horizontal line outlining the bilateral sciatic notches is made. Then a vertical line is also drawn overlying the spinous processes of the lower lumbar and sacral area. Then on the horizontal line, a 2 centimeter mark is made from the vertex of both lines, and another mark 2 centimeters directly cephalad. This mark should outline the right-sided S3 foramina. We then tried to pass a 5-inch spinal needle through the S3 foramina with 2 to 4 volts of current to elicit both bellows and plantar flexion of the right
so his
big
sacrum
toe.
does fall off pretty dramatically, but you can still see the hillock here on the anterior portion of the sacrum, which commonly denotes S3. The shadow here, we follow to the ventral plate from the iliac. The first foramen caudal to that is commonly S3 as well. And if you split the difference between the tip of the coccyx and the sacral promontory, it's normally S3. And all 3 of those criteria are met right here.
Okay, what was I doing?
Falling asleep.
Picture?
Perfect. All right, let's see what we got here.
You a party on Thursday night.
2, 4.
The paper.
That's too funny.
2, right there. There's your bellow at 2 in your toe.
Well, it's actually a 1. Hold on.
Is it
Go
a
ahead.
1?
Keep it there. Yeah, hold it.
It's a 1. There's your bolt. There's your bellow.
Okay, go ahead. Do it a few times. Yeah, go ahead. Keep doing it a few times.
All right. Do you want to see his toe as well? Plantar flexion of the great toe.
Well, how do you like that? Go ahead. Do it several times.
And your new picture's up on the...
Good job.
So they can, yeah, very good job.
Let's use the...
Again, it's the threat of me dressing that makes the whole thing come together.
No, I think it's a jump. Take that white cross, let's put it back together.
Our demographic information denotes Group 1 noted to have 146 patients with motor provocation at less than 3 volts on 1 or more leads. Group 2, 122 patients with motor provocation with 4 volts or more on all leads. Clinical results, Group 1's mean voltage of the leads less than 3 volts were 2.2 plus or minus 0.6 volts. Group 2, at greater than 4 volts, the mean leads were 6.3 plus or minus 2.3 volts. Mean follow-ups of Group 1 exceeded 8.4 years, while for Group 2, 9.6. Group 1's mean 24-hour frequency episodes improved from 18.7 to 9.9, and Group 2 from 17.8 to 11.9 voids, with a piercing coefficient less than 0.02. Group 1's daily urgency episodes decreased statistically significantly compared to Group 2. Daily urgency incontinence episodes also decreased statistically when compared to Group 2. Importantly, urinary distress inventory scores were profoundly better statistically in Group 1's performance. We need to discuss 3 potential technical maneuvers to improve needle placement for motor provocation. First, use the long 5-inch instead of the 3.5-inch needle. It may be more nimble in the hand for many surgeons. Number 2, just prior to needle exploration, place your electrical source directly to your needle with the power set at 3 volts, so prompt bellows and plantar flexion can be immediately detected during needle advancement. Number 3, start needle exploration 2 centimeters lateral to your obliquely placed demarcation line of the medial aspects of S1 through S5 foramina. In conclusion, having one lead placement at less than 3 volts may statistically decrease the frequency, urgency incontinence episodes, and urinary distress inventory scores. We should encourage further prospective studies to confirm our results. Thank you.
Put it in your social.
Go.
This is 2 amps. There's your bolt. There's your bellow.
Okay, go ahead, do it a few times. Yeah, go ahead. Keep doing it a few times.
All right. Do you want to see his toe?
Okay, go ahead.
Screenshot. There's your plantar flexion of the great toe.
How do you like that? Go ahead, do it several times.
And your new picture's up on the screen.
There you go. And that's textbook.
Ta-da!
And then we'll get an AP on the way out, John.
Okay, that's it.
Floral time has come to an end.